Hi guys, now we're up to session 11. I hope you've taken the trouble to look at the last sessions on septic shock and cardiogenic shock. Today we have what is a little more complex one called clinical situations that could have been avoided. Now we know as clinical nurses things will go wrong, but we have to do everything possible to stop it happening. We have topics such as deep vein thrombosis, IV infiltration, medication errors, heparin therapy, blood transfusions, falls, postoperative pneumonia, a nurse's responsibility, and paralytic ileus. I'm not going to be able to discuss all of these in great detail, so I suggest you go on to dearnurses.com and just click on that topic, clinical situations that could have been avoided. There is a lot to learn. We're just going to briefly go over these ones. Now let's take the patient who is in deep vein thrombosis. This is in clinical picture number 1. Well, it's scenario number 7 rather. This patient hates to wear her TED hose, and you know you put on those SCDs also for patients to prevent them getting deep vein thrombosis. It's not so much a question of what that patient likes or doesn't like, it's what is right, what the doctor orders to stop getting a DVT. Look at the end result. Now she's saying, "Nurse, that I have a pain in my calf," which would be classic of DVT. So I urge you to take a look at dearnurses.com to find out more. Then you have the nurse here who's hung an IV on her patient in number 2 scenario. What's happened here? Potassium is hanging. The patient is complaining that she's having pain in the veins, and the nurse is saying to her that she's just followed the doctor's orders. Now this is not good enough because potassium can be rather painful, and can not only potassium, other medications as well do significant damage to the veins. So if you have a patient who's complaining of pain in the veins when you start an IV, you have a responsibility to take action, let the doctor know, stop it, and follow his instructions. So I urge you again to take a look at clinical scenarios that could have been avoided. And how about the young nurse here who made a medication error, not because he was irresponsible, but because he received some bad news and proceeded to do his work but was a bit disoriented and wound up making a mistake. And that can happen to anyone. We're going to talk a little bit more so other medication errors that can be made. And you know, as nurses, we all try to do the best we can, but even the best nurse, if she gets a bit confused, some bad news, can make a mistake. This nurse in number 1 hung the blood. Well, she hung the blood, but the problem was she did not take the trouble to check it with 2 licensed persons, and she's about to find out there was more than one patient with the same name. And that's the kind of thing you want to avoid when you hang blood, because that is given through the veins, which means it's going to be absorbed very quickly, and you will get a quick reaction. Now, let's take the case of this patient in number 2, who has got all this blood all over her clothing. Why? Because she's on heparin therapy. You need to learn more. If you have patients on anticoagulation therapy, they have that potential for bleeding. And bleeding can occur from anywhere. It can be the gums, it can be from the dressings, it can be in the urine, it can even be around the IV sites. So take the trouble to learn a bit more. And how about this patient on the floor? Nurse is saying, "What happened?" He says, "I have no idea." Well, he had something for sleep, and the bed rails were not up. And there are ways that you can stop these things happening. If you've medicated a patient, you should take the trouble to put the bed rails up, put the call light within reach, and there are other things you can do. Please take the trouble to read situations that can be avoided. And now we're going to go on to some other topics that might be helpful to you in the clinical situation. Well, here we have Allie. A nurse has a responsible role to play. She takes an IV. What does she do with it? She puts it into the sink. Take a look at the tubing. She did not take the trouble to put the IV when she emptied the fluid out into the trash. And if you take the trouble to look at that site, you will be very sorry to find out what happened when the nurse who followed her winds up slipping in that mess. Infection control is a biggie, because how much time and energy do we take when we dump things to dump them in the right place? And in that particular scenario, you will read more about infection control. Then here's a paralytic ileus. I don't know how familiar you are with the patient with paralytic ileus, but a patient with a paralytic ileus potentially can have really severe problems with the abdomen. It can after surgery a patient is at risk for it. Even medications like codeine and other narcotics can slow the bowel down and lead to a paralytic ileus. Classically, what you would expect to find are things like if you took your stethoscope and listened, you get no bowel sounds, the abdomen's very distended, patient's miserable with pain. So again, you can learn a lot by reading about it. And then we have this other patient here she is post-op and she does not want to do what she's supposed to do. How many times have you had a patient say to you, I don't feel like taking deep breathing exercises? It's not really a feel-like thing, as it's a responsible thing for the nurse to do patient education to explain to patients the danger of postoperative pneumonia. You can have successful surgery and wind up with postoperative pneumonia, delaying healing and delaying discharge from the hospital. So you really don't want it to progress into anything worse. I once had a patient who the nurse had medicated for pain and she was not encouraged to deep breathe, and I came and found her very lethargic, and I checked her lung sounds and you could tell that in the bases of the lungs they were beginning to get decreased. I encouraged her to use the TriFlow, which she did, and ultimately everything got turned around. So it's not so much what the patient feels like doing as what you as a nurse has a responsibility to do. So I urge you to take a look at these topics, enjoy learning from them, and we will hopefully post you more clinical issues. Again, you can take a look at this by going to dearnurses.com and clicking on clinical scenarios that could have been avoided. Have a great week.